I'm Dr. Goldie Byrd, Professor of Social Sciences and Health Policy and Director of the Maya Angelou Center for Health Equity at Wake Forest University School of Medicine. My research is on looking at genetics of Alzheimer's in African Americans. And the reason we conduct this research is because we know that Alzheimer's disease is more prevalent in African Americans and also Hispanic Americans. We know that this difference is based on any number of reasons. We don't quite know the true etiology of the disease, but we do know that there are differences. At the Maya Angelou Center for Health Equity, my team is on the ground every day, working with communities, particularly under-resourced communities, assuring we're doing everything we can to close health equity gaps. We are working with students. We're working with students at all levels. We're working with community-based organizations. We're working with faith community. We're conducting research to address health equity. When I was at North Carolina A&T State University, which is the largest historically Black college university, we created a center, and we called it the Center for Outreach in Alzheimer's, Aging, and Community Health. Much of the work we did there was to support caregivers, persons who were caring for loved ones with Alzheimer's disease.
I might start crying, but I am extremely grateful for Coach because where I didn't have knowledge before as to how to relate to my mom, who is no longer my mom, she's become a patient. She's become someone I happen to love that I'm caring for. Coach has given me skills, strategies, resources. I've been able to connect with other family members who are going through the very same thing.
For 10 years straight, we conducted a caregiver conference where we brought people in from all across the state of North Carolina to learn about how to care for people with a diagnosis of Alzheimer's disease. So it was very inviting, and we asked a lot of questions of the community, and when they told us, we did what they asked us to do. So in 2018, I joined the faculty at the Wake Forest University School of Medicine to lead the Maya Angelou Center for Health Equity. At that center, we are involved in research. So we continue our Alzheimer's disease research. We do an enormous amount of community outreach and engagement, and I believe that's why Wake was interested. And then we train students, we train the next generation of folks who will conduct research or go into medicine. These communities where we see a much higher prevalence are not genetically inferior. It is, we know for sure that Alzheimer's disease could be prevented by about as much as 40% if circumstances were different. So it's important then for us to look at our ancestral background so we can determine very uncommon variants that make one group of people more susceptible than others. So we just recently received a sizable NIH grant to look at the genetic architecture in African Americans, Hispanic Americans, and Africans. So we're really excited about that. We work with 4 institutions in the United States and 9 countries in Africa for this work. My hope for the future is that we will be able to close some of these disparity gaps and that everybody has the opportunity to live their best life and their healthiest life.